Okay, so my name is Nasir Mushtaq. I'm assistant professor at the College of Public Health with the Department of Biostatistics and Epidemiology, and at the School of Community Medicine with the Department of Family and Community Medicine. Today it's our session 3 for the series of building blocks lecture series for research skills. I'm going to give you an overview of a research question. We'll discuss some of the elements of research questions. So the learning objectives for this session is to provide you an overview of clinical research. We will discuss how clinical research is different from clinical practice, discuss ways to develop research idea and importance of clinical equipoise, discuss research hypothesis, and identify elements of a good research question. So the first is the clinical research, the difference between clinical research and clinical practice, although these two goes hand in hand because we do clinical research when we are in clinical practice, or most of the time there is an element of clinical practice. Clinical practice is what we do when we interact with patients, and that is on an individual basis. For example, this morning you had a patient who was hypertensive. You treated that patient with any medication, for instance with beta blocker, and that medication worked for him. His hypertension is controlled. He came back to you after 3 weeks and it's working well for you. That is a clinical practice, that your medication, your treatment or intervention worked for one individual or for one patient. But would that intervention or that treatment work for each and every patient that you see in your clinical practice? Answer is maybe not. Not for every patient. You might have to offer different treatment. But why this treatment work for some group of patients and not for everyone? That why question can be answered with clinical research. That is where you develop your research idea and you go into the realm of clinical research. So clinical research designates activity designed to test hypotheses, permit conclusions, and thereby develop or contribute to generalizable knowledge, which is expressed in theories, principles, and statements of relationship. In clinical research, we are generally thinking about how something happened in human subjects. And broadly, clinical research covers all studies of disease and trials of treatment that actually take place in human subjects. Another way to think about clinical research is any research that involves human subjects or tissue or material from humans. This may also include not only biological samples, but also information about someone's behavior or other patient characteristics. Other characteristics of clinical research is that it should be empirical and critical, and that the result must be observable, documented, and examined for their validity. The importance of clinical research has increased in the recent years. If we were sitting here a couple of decades ago, this term evidence-based practice would be new to us. But now most of the knowledge that we utilize in clinical practice, that comes from evidence that we see that is published in clinical research studies, in scientific journals, in scientific conferences. So all those evidence is generated based on clinical research. So that highlights the importance of clinical research.